Welcome to a new episode of our weekly series on COVID-19, Science in Context. The UK has now reached more than 4.4 million confirmed cases, and more than 34 million adults have now received their first dose of a vaccine. I'm Stephen, and joining me today is Dr Anne Cori. With restrictions in the UK set to ease further in a few weeks' time, can we expect a third wave?
Yes, we currently estimate the reproduction number is around 1, but we haven't had enough time to assess the real impact of the latest reopening step. So it's likely that transmissibility is actually higher. So yes, infections are likely to rise as easing continues. Our most recent models suggest that this future wave should be relatively small, but that is if, and this is a really big if, we prevent the importation and emergence of variants of concern, as these could cause a very large wave, potentially much worse than the last one, unless we resume non-pharmaceutical interventions or have new vaccines that are more effective against these variants.
What impact is the vaccine rollout having?
Rollout in the UK has been one of the fastest per capita in the world, and uptake so far has been very high, which is great. I am slightly worried about potentially low uptake in younger age groups. That would increase the size of the next wave, but I hope uptake will be high given the decision to offer a range of different vaccines to younger groups.
How could the resumption of international travel impact the epidemic in the UK?
So every day, cases of variants of concerns are being detected in the UK, and it's likely we're not picking up all of those. And that is in a context of very strict guidelines regarding travel. And if those guidelines are being eased, more variants are likely to be imported. And I think this is really the single biggest threat to the epidemic in the UK at the moment. In the short to medium term, restrictions which minimize the risk of importation of variants will be critical for the UK and contributing to the global response to ensure that other countries also control their epidemics will help ensure that we can return to a more normal travelling pattern in the long term.
Thanks for your time.
Thank you.